This video is on the importance of having a good summary statement prepared when the dentist comes to do a dental exam. The summary statement should include an introduction to the dentist so that your dentist knows who your patient is. It should also include their health status, any significant health concerns, what the patient's chief concern is, or areas of concern, and then also clinical and radiographic findings that you have noted. These dentists are doing many dental exams every clinic session they're in, and it's very difficult for them to sit down and know anything about your patient unless you tell them. And using professional language, you should be able to communicate both what you find important about that patient and the patient's needs as well, so the dentist can do the most thorough exam possible. Starting with the patient's chief concern, it's important for the dentist to know if it's pain, if it's discomfort, or if there's an aesthetic concern that the patient has. If your patient's chief concern is pain or discomfort, it's important to communicate to the dentist whether the pain is constant or intermittent, how long it has been occurring, and also if there's something specific that brings it on. And then you'll want to give the dentist information about your patient's status, whether they're a new or a returning patient to our clinic, the date of their last dental hygiene therapy, and what type of dental hygiene therapy was done, if they have a history of having scaling and root planing done. They also need to know the frequency of hygiene therapy, if we typically see them every 6 months or every 3 months. It's also important to communicate the health of your patient by giving the dentist their ASA status and then also outlining the significant health concerns that that patient has. The dentist also needs to know what your periodontal diagnosis is, if they have localized or generalized periodontitis, and then the type that you have diagnosed. Also, a dental history of your patient is important, whether that patient grinds their teeth and wears a night guard, whether they have a history of periodontal disease and surgeries, if the patient has had their wisdom teeth extracted, if they have dental implants. Then you can get into what your clinical and radiographic findings were. One thing with this is that you really want to give a nice summary of the data that you've collected and not go overboard with detail during your summary statement. So for example, you could say that on your patient you noted a lesion on the right buccal mucosa that you'd like the dentist to look at once he gets in the mouth. Or you could say that you had noticed some suspicious areas radiographically that you would like the dentist to look at. Giving them that general statement before you get into detail will help them get a better idea of what you've seen before they get into the mouth. So again, you can give more detail as the dentist is examining the patient as they're in different quadrants. For example, I see that you're in the lower left, and I had noticed some stain around the amalgam on number 19 occlusal. That way, the patient knows that you and the dentist are communicating well, and you're also being attentive to where the dentist is and giving him information as it becomes relevant to him or her. Those are the important things that involve a summary statement. Let's look at a few examples and see what you think of those.
Okay. Hi, Kimber, your name's on the board for an exam today.
Oh, yeah. I'm glad you're here. We're ready for you.
All right. Hello.
Hello. Oh, yeah, Christina.
Kimber.
Yeah, this is Dr. Regalado.
Hi, I'm Dr.
Hi.
Love. Nice to
Nice
meet
to
you.
meet you.
Yeah. So, things look really good.
All
She's
right.
healthy. She takes good care of her teeth. She's
Good.
pretty boring.
Boring.
She's really super healthy.
Okay.
Doesn't take any medications that I have. She takes good care of herself.
All right, so there's no medications and ASA, therefore, type
Yeah. Oh, yeah, type 1.
1.
Yeah.
Okay, so you're probably feeling great now? Feeling
Yeah.
good?
Ever since I take the thyroid medication, everything's been fine.
Ever since you've been taking thyroid medication, it's
Yeah.
fine.
Oh, yeah.
Okay.
Yeah, she takes
Okay.
yeah, that's right. She takes levothyroxine.
She takes levothyroxine.
That's
Okay,
right,
that would
yeah.
be probably nice to know. Dental history,
Oh,
thumping.
she had braces when she was in high school.
Okay,
Mhm.
that's good. That's good
And,
for me. I'd like to know that.
Yeah, she brushes really regular, and she flosses every so often. Yeah.
All right.
She's come here before.
We have x-rays?
Yes.
Okay.
Yes, we took bite wings
Maybe
today.
I should probably put them up on the computer.
Oh yeah, here, let me do that for you.
Oh, okay.
Don't trouble yourself. I'll
Thank
do
you.
it.
You're so thorough.
Yeah. I don't know, Christina, was there anything that was bothering you that you wanted him to take a look at?
No, just some pain on the upper right.
Oh, okay.
Yeah.
You have a toothache on the upper right.
On the
Okay.
upper right. Yeah.
And did you have anything noticed about that?
I did. Now that you mention it,
Okay.
I remember. Yeah, there was a shadow on the film right there.
Right there. Yeah, that cavity right
on
there.
3 mesial. Yeah.
Okay. All right. Well, why don't I do your exam? Thanks, Kimber. All right, Christina, I'm going to go ahead and do your exam now, if that's okay with you?
Okay,
All
yeah.
right. All right.
Can you check number 12?
Yeah, when I get to number 12, I'll check that.
Okay.
Yeah. Right, if that's okay.
Ow, 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 ouch.
Oh, are you okay?
Oh, her teeth are so sensitive. I can barely touch her.
That would have been good information for me to know.
Okay.
That would have been really good. Christina, I'm going to do this again. I'm going to go very, very softly. Okay. All right. Okay. Wow, that's quite a big cavity in that tooth number 3.
Really?
I didn't see you. You didn't mention that one to me, did you?
No, I did not see that one.
Okay, well,
I missed it.
you've got pretty much half that tooth is missing there on the distal. That probably is the source of her toothache, would you say?
I think so.
Okay.
Yeah, that's okay.
All right. And now, checking tooth 4, 5, 6.
Are you on number 12? Have you made it there yet?
I'm on tooth 6. I am not there yet.
Okay.
I'll get there.
Okay.
All right, great. Ah,
So on 12,
yeah.
there is a pretty dark stain in the pit back there on the distal.
Yeah, there's a little stain there. Doesn't register to me as anything very, the needing treatment, so we can move on from there. Okay.
Are you sure?
Oh, by golly, no, Kimber, maybe I'm wrong. It's probably a huge cavity, needs a root canal. No, I'm sure, it's fine. Trust me.
Okay.
Okay, I'm sorry, I'm showing a little, never mind. Okay, all right, I'm gonna check your lower, my goodness, that is some lesion on that tongue right there. How long have you had that huge bump right there, Christina?
Wow, like a month?
A month, okay. Did you mark the lesion down?
You know, I have not done the oral cancer screening yet. I was gonna do it next. I really was.
All right, you know what? Tell you what, Kimber, tell you what I'm gonna do. When you're more prepared for this exam, I'll come back and see you, okay? How about it?
Okay.
So the student missed lots of things. It's kind of hard to just pick one. She really made the dentist search for all of the information that he needed during the exam, and she neglected to look at what the patient's chief concern was. Also had not done her oral cancer screening yet, and didn't give the dentist information that was really important to him to know, such as that the patient's teeth were really sensitive. So there were lots of things that the student missed, and let's see how the patient, the doctor, and the student felt about that summary statement afterwards.
I felt really frustrated with the student, and I feel like she was not well prepared for the appointment. I feel like it's pointless to give her all of my information when she does not really utilize all of the information. And I think the way she talked to me or the dentist was not very professional.
Kimber just wasn't prepared at all. And she's a senior. I mean, you'd think a senior would know how to do a simple summary statement, make your patient feel good. I'm sorry, I shouldn't have got upset, but I did. I probably embarrassed her and the patient. Probably thinks I'm an idiot, but darn it, I care about these things, I guess.
What?
Before I'm gonna go do an exam, it would sure be nice to know that every single tooth in her mouth is so sensitive I can't touch it. Don't you think that would be a little important to know? How about health history? You know, everybody has one. Dental history, just gotta have one. Did I hear a chief concern? I don't think so. I'm sorry, I'm still mad about this.
I mean, okay. So I was gonna do the EOIO next. That really, I really was. It was like next on my list. So, I mean, I would have seen that lesion on the tongue for sure. In hindsight, she was having pain in the upper right, so I probably should have looked there more carefully. So yeah, okay. I mean, maybe I missed like a couple things, maybe. But
Well, what about your patient taking levothyroxine?
she didn't tell. I mean, it was the last student had done all that with her. And when we sat down, I said, "Have there been any changes?" And she said no. So I don't see how that's my bad.
I think I need to request a different student to provide the care for me next time, because I want to make sure that I receive a good quality of care when I come to the clinic.
So you can see that because of the lack of detail and attention that the student gave, the patient did not really feel comfortable or confident in that student's abilities. And that's one thing that doing a good summary statement can help us do, is not only present ourselves well to the dentist, also help instill confidence as a clinician in our patients. So let's look at a couple other examples, and hopefully we'll see that things have improved quite a bit.
This is the spot. This is on your lower right side down here, and that's what I want the doctor to take a look at.
Hi, Kimber. How are you?
Hello, good. Christina, this is Dr. Regalado.
Hi, Christina. How are you?
I'm good.
Good to see you today. Well, tell me about your patient here.
So Christina is a returning patient to
Okay.
us. She comes in every 6 months.
Great.
She's very healthy. She's an ASA class 1, and no medication. She does take a multivitamin every day.
Okay.
We updated her bite wings today.
Perfect.
We were
I
just
see
talking
that.
about how there's a couple spots that I want you to take a look at as well.
Okay.
Her dental history includes having braces about 10 years ago.
Oh, I had braces, huh? Oh, good. Great result. I like that. Okay.
Yeah, she also had her wisdom teeth taken out when she was 17.
Okay.
She has slight localized chronic periodontitis. She also grinds her teeth. She wears a night guard about half the time.
Okay.
And she's been wearing it for about a year now.
Okay.
So we talked a little bit about that.
All
And
right.
her main concern is actually that her front teeth are a little bit chipped because of the grinding.
I see. Okay.
So she was wondering if we could do something about the aesthetics there.
Okay.
Let's see. Yeah, and then
Anything
we
else?
just had, no, just those couple areas, one on the
Okay.
x-rays and then one in the mouth that I wanted you to
One
take a
side.
look at.
Okay. Is there anything else you want to add to anything that she has already brought up?
No, I think she covered everything really well.
Okay. I think that's a great start. Let's get started in the exam.
Great.
Okay.
The student did a nice job of using professional, courteous language. Also, she communicated all of the important information to the dentist and allowed time for him to ask questions when he needed to as well. So that was a very nice summary statement. Now we'll look at another example for a patient that's a little bit more compromised.
Christina, this is your lower right down here, and I know this is where you're having a lot of pain.
Hi, Kimber. I
Hi,
see
Dr.
that your
Regalado.
exam is due. Are you ready?
Yes, we
Okay,
are.
Great.
Yes, Christina, this is Dr. Regalado.
Hi, Christina. How are you?
I'm really good.
All right. Good to see you here today.
Nice to see you.
Well, tell me about your patient here.
So Christina is new to our clinic today.
Welcome.
Her last cleaning was 5 years ago at her dental office, and
All
they
right,
did
good.
a deep cleaning on her. So
Okay.
scaling and root
I
cleaning.
went down down to the different areas. They numb you up for that?
Yes.
Okay. All right.
We took a full set of x-rays and pano on her today.
Okay. We'll check those out.
She is more medically compromised. She's an ASA class
what about
3.
Okay.
She has type 2 diabetes.
All right.
Her last A1C was 8, and that was 6 months ago.
Okay. 6 months. Nothing more recent than that, but it was an 8.
Yeah.
Okay.
She also has high blood pressure, and she
Okay.
controls that with lisinopril. And today her blood pressure was 135/82.
Okay.
Then the other medical condition she has is hypothyroid, and she
Okay.
controls that with levothyroxine.
Okay.
Mhm.
All right. So, do you monitor your blood glucose levels then yourself?
Yeah.
Okay. And what did they like this morning? Did you check it this morning and see what it was?
It was about 110.
About 110. Okay. Good. All right. That sounds good.
Okay. That was all I had for her health.
Okay.
For her oral health, she has generalized moderate with localized severe periodontitis.
Okay. All right.
She had her 3rd molars removed when she was a teenager, and 2 months ago she had an abscess on number 13, and she had that tooth extracted.
Okay, so that became a pretty bad toothache for you, then, did it? On through the, okay. All
Her
right.
main concern today is that she has a lot of pain on the lower right when she bites and chews. She's had that for the past 2 weeks, Christina, is that right?
Yes.
Okay.
All right.
And then there were some areas in her x-rays
All right.
and also intraorally I wanted you to look at.
Very good. And why don't we do this then, Kimber? Why don't you and I together just go over the x-rays?
Okay,
We'll see what
let's
you
do
got.
that.
All right, let's do that.
So again, that was a very nice, thorough summary statement that used professional language and also helped communicate all of the relevant and important information that the student had been gathering over the course of the appointment. Relay that to the dentist so that when he sits down, he's informed and has a really good idea of how he can help treat that patient the best way possible. You should now have a pretty clear idea of all of the different things that you need to include to have a nice, thorough summary statement when you do your dental exam.